Welcome to IMCAS TV with Dr. Alfandari, Dr. Chiaravalo, 10 minutes with the PIP scandal. And we're starting our day with this scandal because this is the first subject of the day. It's been a little over a year since the PIP implant scandal surfaced, and I'm sure cosmetic surgeons are and have been facing calls for tighter regulation. PIP, as you know, was accused of using substandard silicone to fill implants in 2001. Approximately 400,000 women worldwide may be affected by the PIP implants. I'm here with Dr. Alfandari. You are a plastic surgeon, and you are president of the National Association of Plastic Reconstructive and Cosmetic Surgery, which is the union, and one of the plaintiffs in the PIP trial. Dr. Chiaravalo, you are also a plastic surgeon and president of the Italian Association of Aesthetic Plastic Surgery, and more appropriately for this interview, you have collated all of the doctors' information from Italy concerning the PIP scandal. Dr. Alfandari, I want to start with you because I want to know, where are we legally speaking now with PIP? I believe there is an upcoming trial.
Yes, you are perfectly informed. There is a trial which will be in April, on the 17th of April. And there is now more than 3,000 patients we are going to this trial. It will be a big trial. As you know, you said that we are plaintiff in this trial. To be perfectly honest, we are the first plaintiff in this trial, and we hope that this trial will permit to people, for patients, but also for surgeons who are victims, to know what happened and how we can do for it never happen again.
Absolutely. And in Italy, is there going to be the same kind of legal process?
Definitely, definitely. And the problem is that, the big problem with the PIP is that patient and surgeon got the problem, not only patients.
Of course.
And due to this fact, we were accused by the magazines, by the newspaper, by the press, but actually the fault is not of the doctors, and it goes up to some other people. And I hope that in the trial, they will come out with some sentence or something that will define whose fault it is.
Yes, we'll relieve not only, like you say, the patients, but also the doctors of this worry. Where are we now with the patients?
Like we say, the consequences of these problems were the fact that there is some silicone, it's an industrial silicone, which is inside of this implant. There is definitely a higher rupture rate, but we have to know exactly which position each patient has. Because to myself, to have a rupture implant is not a disaster. If it is ruptured, we can just change it, and it's no big deal. If the implant is not ruptured and it's in good condition and the patient has a good result, to me, she does not have to be fearing any disaster, just checking every 6 months with the doctor, and that's it. Unless she's got some sort of anxiety, if she's worried, she can go to the doctor and the implants can be changed.
And have you seen complications with the PIP implants?
Yes, of course.
And what can be done is the
we are not from
larger question.
We are not from the same countries. You know, it was at the beginning. It was a French problem. Even if there is, more than 500,000 people patients in the world.
Yeah.
But it was really the panic last year, and when government and professional has to remove the implant, there is a panic in the office of a plastic surgeon. So, and I remember that we asked to the journalists to have some safety advice to the patient, and you follow
information that can go
and
out.
you follow us. And 1 year after, there is more than 14,000 people who have the surgery, and
who have had the surgery of the implants
during
taken
last
out.
year, during last year, and there is not major problem. Of course, you're right. There is few of the implant with rupture with problem. And we have we have no accident with the surgery. It was a very big point because every time that you do something like that, when you do a lot of surgery in short time, you can have problem, and there is no problem. But we continue to give the advice to change the implant for PIP because it's not like in your country. Because for patient, of course, there's not major problem of implant, but for patient, they don't feel safe with PIP implant, and we need to remove it.
And you can understand that concern from the patient,
Of
obviously.
course, we are concerned. It's why we do surgery.
Now, I don't want to start an international incident, but you both disagree on something, and that is systematic removal of PIP. Dr. Cervolo says no, you say yes. Can you tell us why you feel the way you feel?
Yeah, because at the end, all the studies that were carried out on the PIP implants, they ended up showing that the implant can break earlier than the other ones. But they ended up saying that the silicone is not a poison. It's an inert material. So even if you have some silicone, which is broken in a capsule, that patient will never have any serious disease out of it. So if the result is good, I would rather have that implant there unless it's broken naturally and unless the patient she's anxious. I would leave the patient with those implants if they are good, and maybe, after 5 or 6 or 7 years when that implant will be old, I will change it.
And then you change it.
Okay.
But not systematic.
Not systematically. To me, if a patient with a great result and intact implants comes to my office, I see no reason to worry her and to tell her you have to remove the implants. I would tell her, this is the situation. If you want to remove the implants, I will. But if you remove the implants, you have to start again another operation.
Yes.
And you can have some more complication to it.
Yes, any surgical procedure, there is the risk.
Absolutely.
Of course. The other side.
There is three ways to think. There is a medical way, there is a social way, and there is a medical legal way. For medical way, of course, there is no emergency. It's not good implant, and I think we have to remove it. But for medical legal, of course, now we are not very easy with this problem because we think that it's not easy to keep the implant in place.
Yeah.
And even for patient, because if they have, for all patients, there's no problem. If one patient have a problem, he will say, "Oh, you leave my PIP implant." And in France, especially, not for other country, because in France there is a lot of article of media press on PIP. And when you do surgery to a patient, usually she forgets she have implant, she have new breast, she have breast. And with PIP in France, they can't forget. They are not safe with the PIP implant. So indeed, it's not dangerous, but it's a bad surgery with PIP implant.
Yes,
it's more easy to remove it, and they feel good better than to keep it.
So it's more of a reassurance.
Of course.
So I just want to point out something. I think that what my friend says is correct. The fact is, as in 2013, all the doctors are faced with a dilemma. Should we act under scientific principles or under medical legal principles?
Yes.
No? So what we are doing is defensive medicine. Sometimes we have to operate or not to operate on a patient because the law or the judge or the trials that can come out can create a problem. So this, unfortunately, all doctors have this sort of problems today. And the PIP fact is influenced by medical legal reason too.
Well, thank you very much, and I hope to see you both next year where you can tell us the results of the trial in April. Thank you very much.
Thank you.
Thank you very much. Thanks.